Hi, I'm Felicity, a registered nurse, cosmetic injector and clinic owner. Welcome to my channel, The Fit Injector. Now, as most of you know, I'm pregnant. So I thought what a fantastic time to start bringing more education around cosmetic injectables and pregnancy. Now, when my clients fall pregnant, they often get quite a shock to find out that they have to hold off on their anti-wrinkle and their dermal filler treatments for 9 months. Then I'll ask them whether they're planning to breastfeed, and I give them a double shock because they have to wait until they've also finished breastfeeding. Now, why can't we have cosmetic injectables when we are pregnant or breastfeeding? So unfortunately, there's just not enough research into the effects of these medications and what that could potentially do to either an unborn child in the uterus or a breastfed baby. Now, obviously, anti-wrinkle medications and dermal filler products have been used on adult patients for decades and are safe when used with proper dosing. But it is just unknown how these medications could potentially affect the breastfed baby and the unborn baby. Now, why is there such a lack of studies for products that have been around for so long and used on so many patients? Well, that is mainly due to the complicated ethics of researching the effects of these medications on pregnant and breastfeeding women. Now, although most of you will consider your cosmetic treatments essential, myself included, injectors, we have a complete blanket rule, and you'll see this on your consent forms. And when you do come into clinics, every time for treatment, we will reconfirm if you are pregnant or breastfeeding, and we will not proceed with any treatment during that time. Now, this rule also extends to platelet-rich plasma, PDO threads, most lasers, and some skincare products. And that comes down to the ingredients and also numbing agents that are used for a lot of these treatments. So now I've given you the bad news, let me give you some good news. So there's actually so many skincare products that you can use on the market that are completely safe and also really beneficial while you are pregnant and breastfeeding. Now, while it is best to avoid vitamin A products, salicylic acid products, hydroquinone, and any prescription-based topical products, things like a prescription-based vitamin A for skin concerns, there are a lot of active ingredients that you can use. So using cleansers, AHA products, vitamin C, vitamin B, hyaluronic acid, and sunscreen are all completely safe and can be so beneficial for those hormone-related skincare conditions that we experience through breastfeeding and pregnancy. Now, hot tip here, please do not leave the house without sunscreen on your face when you are pregnant, because we are prone to a hormonal pigmentation called melasma, which can get quite bad when you are pregnant and also breastfeeding, and it can be really difficult to treat. Now, treatment-wise, the good news is you can have a range of light peels, AHA-based peels, which is your lactic and salicylic acid. You can enjoy masks and facials. Most facials, just obviously check the ingredients when you go to have those treatments. You can have microdermabrasions, and there are actually a lot of laser-based treatments on the market that you can have. And often this includes laser hair removal, which is great because we all know the hormones makes our hair grow like crazy too. Now, always check with your GP prior to having these treatments, and then check with your treatment provider. Let them know when you are pregnant or breastfeeding, and you'll need to go through that consent form to make sure that it is safe for you to proceed with treatment. Thank you so much for watching this video, and I really hope it helps you, particularly if you are pregnant, planning for pregnancy, or you are currently breastfeeding and you're wondering what treatments you can and can't have during this time. If it was helpful, please give it a thumbs up. Don't forget to subscribe for more videos. There will be lots more to come on pregnancy and breastfeeding, and pop some comments below if you've got any questions on these topics, and I'll see you in the next video.